Hello ED, and thank you for taking the time to watch this short video regarding a very important topic for the conserved patient. This is an action plan that took a lot of brainstorming and work from a lot of team members in the organization to make sure that we give the best care to conserved patients and send them home or to the ECF safely each and every time. A patient in the emergency room was released without having their conservator be called or involved in the discharge. This created a reportable event. A departure of a conserved patient from the emergency room is a reportable event. And we had to, as an organization, come up with an action plan as to how we are going to ensure that our patients that have a conservator would be discharged properly. The patient came from an ECF by ambulance with incomplete W-10 and no face sheet. The RN did not receive ECF paperwork to ensure that W-10 was complete or the face sheet was included, and there was no RN to RN report with the ECF. The patient was conserved, and the indicator for conservator was in the EHR, but not easily seen. The EDRN and EDMD all missed the indicator. The problem list was unavailable on the summary page for the MD, and it did not show or signal that the patient's cognitive impairment. The patient was deemed safe to be discharged. The RN called VEO, thinking the ambulance would not be covered, back to the ECF, and the discharge paperwork presented to the patient, who stated he did not want to wait for VEO. He placed the fake call to his daughter for pickup, then waited, and then left. Griffin Hospital Case Management was notified by the ECF by mid-afternoon that the patient's daughter called, stating she had concerns about the father's location. And security footage showed that the patient was getting on a bus near Griffin Hospital ED entrance. His daughter had not come to the hospital to give him a ride, as he led the nurses to believe. He was missing for about 8 hours until his daughter found him and brought him back to Griffin ED. Luckily, he was not harmed, and he was then reevaluated by the ED. What does this mean, and why does it matter? A conservatorship or guardianship is a legal definition, meaning that the court has deemed that an individual who previously had capacity to make informed decisions for health or finances no longer has that capacity to do so. The court puts someone with an intellectual disability that is not able to make informed decision and puts that decision making onto somebody else. So the impact on providing patient care is that the person for whom you need to obtain informed consent is not the person in front of you, it's their conservator. So you need to communicate with the individual that the court has decreed or has decided that this is the person responsible for this individual's health care decision. It's not always obvious, and that's why we all need to be aware. And it comes with coincidental timing that we have the case of Britney Spears, who underwent a court-appointed conservatorship in 2007. So the court determined that she was not able to make her own healthcare decisions, but we're busy healthcare providers, and we may not always be aware that there's a conservator. And if Britney called into our ED today, we may not realize she's under a court-appointed conservatorship. But if we admitted her and didn't consult with her conservator, when we admitted or discharged the provided non-emergency care, then that would be a problem. So the work to get this corrected started with going back to 136 scanned conservator documents. And for each conservator document, there was a special indicator added if it was missing on the patient's chart to notify that there was a conservator, and then the documents were checked for any errors, and they also checked that a guardian document scanned in some cases was not in fact a conservator. There was some that there was a designation of conservator in a living will, which is not the same as having a conservator. A living will says that in the event that they can no longer make decisions, then they have this person who can, but it doesn't mean that it's active. So correcting the erroneous data in the system and continuing to monitor the process is an ongoing project. So this is important for us in the ER because it's going to start with us having a questioning attitude when the patients are sent in from the ECFs. Now, our case manager, Ellen, has informed all the ECFs that this is going to be required if they're sending patients in that have a conservator, that we will be asking for documentation. So first thing, ask if the patient's conserved, and if yes, request that document to be faxed to the ED and that the conservator be notified of the transfer. Once the patient arrives, we're going to notify registration that a conservator exists and that the documents were requested. And we will add an indicator that the patient is or has a conservator unverified or a guardian unverified. Registration will change the indicator to verified once this has been validated and the paperwork has been checked to make sure that it's all correct. So nurses, please look at the W-10, the transfer papers, and look for any indication that this person has a conservator so that we can request the paperwork. And at discharge, the expectation is that we call report to the ECF and say this patient's coming back. Is there anybody else that needs to be notified? The providers would be included in having the discharge instructions and having that discussion with the conservator, and they will document as such. But anything that any conversation that you, the nurse, have regarding the handoff to ECF, whether the patient's coming or going, you want to make sure you document that in your notes, who you spoke to, that they told you a conservator is in place and that the paperwork is coming, so that none of this information is missed. So this is a new process and special indicators have been added. So anytime you have received information that the patient has a conservator, whether we have paperwork or not, we're going to put that conservator unverified in their special indicators. And once those paperwork has been scanned by registration or social work and put into the patient's chart, they will change the indicator to conservator verified, and then that will stay for any subsequent visits so that we don't have to create this process again every time the patient comes in. Same thing for guardian. Once we know that there's a guardian in place, we'll put the indicator, and once registration or social work receives the paperwork and verifies it, puts it in the patient's chart, they will change it to verified. The physicians also have the ability to see in the legal indicators that there is a court-appointed conservator. So this is easily seen on their tracker, so it's not missed. So there will be a few ways that clinicians will know that there's a conservator or guardian. There'll be special indicators that will flag this. The conservator or guardian will be listed as person to notify, and then documents will be scanned into the electronic health record. So who's responsible? Everybody. At all entry points for scanned documents, we're all responsible to add the special indicator, and then registration will list the person to not notify in the contacts. And all clinicians are responsible to review this information. So moving forward for this process and to make sure that this program is sustainable, Registration will run a unverified special indicator daily to ensure that there has been proper follow-up and obtained proper documents. Social services will also run a report of verified and guardian verified and review that the indicators were correctly assigned. And then PSCI incident reports will be entered and reviewed for issues related to any conservator or guardianship. So if you see any variance to this process, please arc it up, stop the line. If you see something, say something, and put it into an incident report so that we can quickly rectify the issue. Thank you so much for watching. If you have any questions, please let me know.